Hello, friends. Now, this is the second part of gypsum products. In the first part, we have seen different types of gypsum products, the calcination process, the setting reaction, factors affecting setting, and how to measure the initial as well as final setting time. Now, in this, we will see the manipulation as well as the properties with some other things regarding gypsum products. Now, coming to the manipulation. So we will be discussing on these points, that is mode of supply, instruments required, water powder ratio, addition of powder to water, methods of mixing and pouring the cast. Now, mode of supply, as every one of us knows, that is it is supplied in the form of powder. The instruments required for hand mixing, the instruments required are flexible parabolic shaped rubber bowl and straight stainless steel straight plaster spatula. And in case of mechanical mixing, we require a mechanical mixer. Then water powder ratio. Water powder ratio is the ratio of water and powder. Now it differs from type 1 to type 5. As the particle size goes on decreasing, or as the particles becomes more finer and finer, the amount of water required to mix the powder will become less and less. And this water powder ratio is specified by ADA from type 1 to type 5. Then addition of powder to water. So first we have to take the measured amount of water and then go on adding powder to it. Now while adding powder, don't add the powder in bulk. Otherwise, you will not get a homogeneous mix, but it may end up into formation of the lumps. So the powder has to be sifted. Sifted means the sifting word has come from sieving. That is like sieve, you are putting or you're dispensing the powder into water so that each and every particle of the powder will come in contact with the water and it will become wet and you get the desired consistency. Now, coming to the method of mixing, there are two types by which you can mix the plaster. One is a hand mixing and another is a mechanical mixing. In case of hand mixing, after complete addition of powder to water, you just have to hold the bowl with one hand and hold the spatula with thumb and palm grip in another hand and then go on mixing it vigorously till you get a smooth and homogeneous mix with shiny surface. So usually the mixing time is around 45 seconds to 1 minute. In case of mechanical mixing, a mechanical mixer is available which is attached to vacuum. So a mix becomes more homogeneous, the water powder ratio is perfect, and entrapment of the air is negligible. So we will just see the Mhm. Now, this is the bowl and spatula for hand mixing. Now, after mixing, there is a chance that some air may get entrapped during mixing. So, after complete mixing, you have to place it on the vibrator. Now, this vibrator is an electrically operated instrument. If you keep this on the vibrating table and put the machine on, then the machine starts vibrating, and whatever air has entrapped inside the mix, it will come in the form of bubbles over the surface. Now, this is a mechanical mixer. This is the pot of the mixer with the blade inside. So, you just have to measure the amount of water and powder and place in it, and then fix the jar to the mechanical mixing device and put the machine on. So, it will be mixed under vacuum. So, there will be the mixing is more fine. Then you can take exact amount of water and powder, and the amount of air getting entrapped is negligible. So, this is a mechanical mixing. Now, coming to gauging water. Now, you find this term which is coming very commonly, gauging water. Now, gauging water is the amount of water which is required by the gypsum products to wet the powder particles to get the required consistency. So, our basic aim of mixing the powder to water is to get the required consistency so that we can use it uh, for the particular purpose. Suppose for pouring of the impression, we require different consistency. For making the base, we require different consistency. But for all these things, the water has to wet the powder particles completely. So gauging water is the amount of water which is required to wet the powder particles to get the required consistency. Now, this much of the water is not required for setting reaction. uh, Water required for converting the hemihydrate to dihydrate is less than the gauging water. So the remaining water is called as excess water, and it remains in between the growing crystals or in between the dihydrate crystals which has been formed. And this excess water over a period of time is evaporated, leaving porosities into the mix. So that is the concept of gauging water. So coarser is the particle size, more amount of gauging water is required. As more amount of gauging water is required, there is more amount of excess water, and more porosities will be there after evaporation of this excess water, and so the product is weaker. Now, coming to the properties. Now, first and the important property is strength. Now, there are two types of strength which are seen with dental plaster or dental stone, that is wet strength and dry strength. Wet strength is also called as green strength. Now, wet strength is measured when there is excess amount of water which is present in the mix. And once this water gets completely evaporated, that is after complete setting of the material, there is a complete interlocking of the crystals, and the strength, if you measure, that is called as a dry strength. And of course, the dry strength is more as compared to the wet strength. Now, if you see the tensile and compressive strength, both are low, but they are more low in case of dental plaster as compared to dental stone. Now, what are the different factors which affects the strength? Now, the first factor is water powder ratio. Now, within the practical limits, if you increase the amount of water as compared to powder, then definitely the strength will be reduced. Then second is fresh stock. Fresh stock has got more strength as compared to that of old stock. Then, um, sorry. Then smaller particle size. Now, smaller the particle size, more faster they will dissolve in water, forming the crystals, and it will affect there will be good interlocking, and definitely it will affect better interlocking, which will increase the strength of the material. Then optimum mixing time. Now, if the mixing is prolonged, than the limit, then what will happen? Whatever interlocking is happening, that will go on breaking, and there will be no proper interlocking, reducing the strength of the material. Then use of additives. Now, use of additives may interfere in between the interlocking of the crystals, which reduces the strength of the material. So these are the few factors which affects the strength of the material. Now, coming to reproduction of the surface details. Now, whenever you pour the impression and whenever you get the cast, so you should get all the surface details which has been recorded in the impression. Now, what are the different factors which affects this recording of the surface details? Now, number one is the particle size. If the particle size is finer, then the recording of the surface details will definitely be good. Second is water powder ratio. Again, within the limits, if you take more amount of water, then definitely the reproduction of the surface details will be less. Then effective vibration of the mix. As I told you, during mixing, there is a chance of entrapment of the air, which may affect the surface details. So after mixing, either you have to tap the bowl over the table or place it over the vibrator, mechanical vibrator, so that all the air which has been entrapped inside the mix will be removed. And then you can use the surfactants. Surfactants, that is, will increase the wetting of the impression surface with the gypsum, which will help in the formation of the reproduction of the surface detail. So this is the second important property. Now, the third important property is hardness and abrasion resistance. Now, if you see the hardness and abrasion resistance of dental plaster and dental stone, it is not that high as desired. Dental stone definitely has got more hardness as compared to dental plaster, but both have got less hardness than desired. Now, there are certain methods which will help us to improve the hardness. Number one, you can use the hardening solution so that it will make the surface hard or abrasion resistance. Then electroplating of the impression before pouring the cast, that will also increase the hardness. And if you do the surface treatment of the cast with acrylic or acetate, citrates, polyesters, then that will definitely improve the hardness of the material. So that is about the hardness and abrasion resistance. Now, coming to the most important property of dental plaster or dental stone is setting expansion. Now, the name itself is suggesting that on setting the material expands. Now, actually, there are three types of expansions which we see in dentistry, that is normal setting expansion, hygroscopic setting expansion, and thermal setting expansion. So out of that, two expansions we will be discussing in this chapter, and thermal setting expansion will be discussed during casting. Now, normal setting expansion is a disadvantageous property as it will result in a small amount of expansion in the cast which we are making. But hygroscopic setting expansion is an advantageous type of expansion, that is because it will be helpful to compensate the casting shrinkage. Now, you can see the values of normal setting expansion of dental plaster as well as dental stone. So first we will see the theory behind the setting expansion, or you can say the mechanism of the setting expansion. Now, as I told you, during the setting reaction, the crystals are formed, the spherulites are formed, and these crystals, after growing, they start intermeshing with each other. Now, at the time of intermeshing, at certain points, the crystals intercept with each other. So at the point of interception, these crystals are opposing the growth of each other, and outward thrust will be created at that point, which will push the crystals apart, isn't it? So with the intermeshing, interception is also occurring at thousands of places, which will push the crystals apart from each other due to the formation of the external thrust at that particular area. Now, due to the pushing, what will happen? The particles are going apart from each other, which will result in the setting expansion. Actually, if you measure the actual volume, that is, if you have taken hemihydrate and water, and if you measure the volume, and if you see the volume of dihydrate which has been formed after mixing the powder with water, so the resulting volume is less as compared to that of the volume of individual material, that is hemihydrate and water. So that is there is actual contraction, but when we mix it, we see there is an expansion. So this crystal interception is the main reason to explain, or to is the main reason behind the setting expansion, because setting expansion is seen. Now, what are the different factors affecting setting expansion? Now, whichever factors which increases the rate of reaction are usually responsible for setting expansion. Now, number one is water powder ratio. Within practical limits, if you take more amount of water, then definitely the expansion will be less, because the crystal will stay apart, they will not come and meet, and then there is no intermeshing, so interception also will slow down. Then second is increased spatulation. Now, when you mixed the material rapidly, or increased spatulation will result in the formation of more number of nuclei, because of the increased spatulation you are breaking the nuclei into number of nuclei. So number of nuclei of crystallization will be more, so increased spatulation will result into increased setting expansion. And effect of modifiers. Now basically the modifiers, they interfere in between the growing crystal. So whether it is accelerator or retarder. Now accelerator usually causes the mass to become rigid very fast. So there is hardly any chance for the crystal to intercept with each other. And in case of retardation, as it is forming an adsorbed layer, it will retard the growth. So there will be no intermeshing or interception of the crystals. So effect of modifiers, the expansion will be less. Now coming to the hygroscopic setting expansion. Now the name itself is suggesting hygroscopic setting expansion means the setting expansion which is occurring in presence of water. Now here we have to carry out this hygroscopic setting expansion. It will not occur of its own. Like said, normal setting expansion, it occurs of its own. But hygroscopic setting expansions, you have to carry out, especially whenever you are utilizing it as a compensatory expansion to compensate for the casting shrinkage. Now, this is the self-explanatory diagram of the hygroscopic setting expansion. During the initial set of the material is again placed in presence of water. Now, the first two diagrams, you can see the hemihydrate are suspended in water. Now, in both the cases, the hemihydrate will start growing. They will start intermeshing with each other, and the initial set occurs. Now, here The initial set will occur in normal setting expansion. The remaining water is utilized by the crystals to grow, and they will start intermeshing and intercepting with each other, resulting into setting expansion. In case of hygroscopic setting expansion, the crystals are growing and you're replacing the water. You're placing it in presence of water. So crystals will take more amount of water and they will grow more and more. So as the growth is more, after interception, the crystals are pushing apart and the setting expansion will be more as compared to that of normal setting expansion. So always keep it in mind that hygroscopic setting expansion is almost double in magnitude than that of the normal setting expansion. Now, coming to the factors affecting hygroscopic setting expansion, all the factors which are responsible for the normal setting expansion, same are applicable to hygroscopic setting expansion. In addition to that, the time at which you are placing the material in presence of water and the amount of water, these two factors will get added into the factors affecting setting expansion. So, this is the most important property of gypsum. Now coming to the uses, dental plaster is used for preparing primary cast, then it is used for mounting the jaw relation record on the articulator and for flasking the wax denture. So these are the three main uses of dental plaster. Then dental stone, it is used for making the secondary cast or working models on which we can prepare or fabricate some prosthesis. Also, it is used for study models. So these are the uses of dental plaster and dental stone. Now coming to the care of the powder. Now always powder, usually we purchase the powder in bulk. So whenever you are purchasing the powder in bulk, you have to place it in airtight container in dry atmosphere, and the amount of powder required has to be taken out and rest of the powder has to be kept separately. Now it has to be kept in airtight container because gypsum products or dental plaster or dental stone, they are hygroscopic in nature. So in case of humid atmosphere, they will take up water and the particle will get coated with dihydrate as it is taking up the water. And these dihydrates are less soluble than hemihydrate. The setting reaction will get retarded and setting time increases. So it should be properly stored at dry places. Then infection control. Nowadays, every day, some new virus is coming. So there is a danger of infection, cross-infection. From the impression, the infection may be carried to the cast and from the cast to the operator. So we have to take care of the infection control. So either you can add or you can use the dental stone or dental plaster in which already the disinfectants are present, that is modified forms of it, then immersing the cast in disinfectant solution. So to avoid the cross infection, after retrieving the cast from the impression, it has to be immersed into the disinfectant solution, or you can do overnight gas sterilization, or you can spray the disinfectant solution over the cast. Now coming to the differences between dental plaster and dental stone. Now, usually this comes during the exam as a short answer question or during the spotting. Sometimes this is kept in this as a spot that identify the materials and differentiate between it. So we have to start from the calcination process. Now, in case of dental plaster, the calcination is dry. That is in the open container without any steam pressure. In case of dental stone, the calcination is wet. That is, you are carrying out the calcination in a closed container under pressure. So the resulting crystals of dental plaster are irregular, large particles, spongy. And in case of dental stone, the resulting crystals are fine, prismatic, small. Now, as the crystals are larger of dental plaster, they will require more gauging water to wet the powder particles, and here you require a less gauging water. Now, as we require more gauging water, in case of dental plaster, the amount of excess water will be more as compared to that of stone. As it contains more amount of excess water, after evaporation of the water, it will lead to porosity. So amount of porosities in dental plaster is more as compared to that of dental stone. And as the porosities in dental plaster are more, the strength will be affected. The strength of the dental plaster is less as compared to that of dental stone. And depending upon the strength, you will find the applications of dental plaster and dental stone. So these are the basic differences between dental plaster and dental stone. Please never write the differences as this is white in color and this is green in color, or this is alpha hemihydrate or beta hemihydrate. These are not the differences. So if you write it stepwise, you will not miss any of the difference. Now coming to the modified gypsum products. Now, if there are any drawbacks, then there is a need to go for modification. Like we have seen, the strength is less or the surface hardness is less. Then there are no disinfectants present in the plaster. So there are certain modifications in modified forms of gypsum products. So we will just go through it fast. So first is the gypsum impregnated with polymer. So impregnation of gypsum is done with polymers like polyester, polystyrene, acrylics, epoxy resins. So it will increase the surface hardness and abrasion resistance, which is much more required. Then second is incorporation of wetting agents. Now, wetting agents such as lignosulfonates reduces the water which is required for mixing and produces a harder, stronger and set gypsum. So this is another modified form of gypsum. Then incorporation of disinfectant, like already I've told you that because of the problem of cross infection, or to avoid the transmission of the disease to the person handling it, disinfectants can be added into the plaster or dental stone. Then balance stone. Now, in many of the dental stone, you will find equal amounts of accelerators and retarders to balance the effect of both. Now, next is the chromatic stone. The chromatic stone is a color changing stone. That is, it changes its color as the pH changes. So it will give you the idea when the mixing is over and when it has to be used, and after setting also the color changes. Then divestment, combination of dye stone and investment many a times is used during your casting procedures. So these are the different modified forms of gypsum product. Now, storage and disinfection, already we have seen the gypsum is sensitive to changes in the humidity. The bulk material should be stored in airtight closed containers. And disinfection, to prevent from cross-infection, disinfection of the cast should be carried out. So what are the disinfectants used? So usually 5% phenol or 2% glutaraldehyde can be mixed with water while mixing. Casts can be immersed in 1:10 dilution of sodium hypochlorite for 10 minutes, or you can use the spray of iodophor to make or for the disinfection of the cast. So this is all about your dental plaster and dental stone. So thank you so much for patient hearing. These are my references. So thank you so much.